All right, good afternoon, everybody. I'm going to have to do it. OH! Oh, it's amazing how that works. Good afternoon, everyone. Welcome to the Columbus Metropolitan Club. CMC explores public policy issues, current events, and lessons in leadership at forums just like this every week. My name's Eddie Pauline. I serve as the president and CEO of Ohio Life Sciences, which is the trade association for the biotech industry here. Proud to be a sponsor of today's forum. I do have to say hello to some of my board members that are in the crowd, so thanks for coming to this great forum today. I also am proud to serve as a member of CMC's Board of Trustees. For those of you who are joining us by live stream, we're coming to you from our home in Columbus's historic Italian village at the Ellis. Welcome to today's program, part of CMC's long-running Optimal Health series. For those of you who are members or longtime CMC attendees, you know that we've covered an incredible range of health-related topics through this series, from cell and gene therapy to suicide prevention to breakthroughs in cancer treatment. We are grateful to the presenting sponsors of this series, the Ohio State University Wexner Medical Center, Nationwide Children's Hospital, and Ohio Health. Let's also thank the sponsors of today's forum, the United Way of Central Ohio, Cardinal Health, Ohio Life Sciences, the Columbus Partnership, and our host, the Ellis. We're also grateful to the presenting sponsor of our live stream, the Center for Human Kindness at the Columbus Foundation, and to our live stream partner, the Columbus Dispatch. Yes, every CMC forum takes a village. Let's thank everyone supporting today's forum. So again, welcome to today's forum, The Future of Healthcare. Columbus still may be working toward an overall identity as a city, but leaders in healthcare have already put the region on the globe as a worldwide hub for health. Our region is now home to 4 major hospital systems and a growing number of global leaders in therapeutics and medical technology. Today, we dive into what the future holds for advanced healthcare in Central Ohio and around the world. We are thrilled to welcome today's panelists, Jason Hollar, CEO of Cardinal Health, Dr. John Warner, CEO of the Ohio State University Wexner Medical Center and Executive Vice President at Ohio State, and our host, returning once again to CMC, Tracy Townsend, anchor and medical correspondent with WBNS 10 TV. Tracy, welcome back to CMC, and we look forward to today's conversation. The podium is yours.
Good afternoon, everyone. Oh, the fun-sized lady has to get the mic just right. Okay. I am so excited to see everybody. I'm glad to see this is a full room. This is going to be a great conversation. I want to say thanks to the CMC for inviting me back. It means that I did a pretty good job last time, and they trust that I won't embarrass them or myself, so that's really good. Doug, thank you so much, because we need producers in the TV news business if this doesn't work out for you. Everything is always so well executed, so I'm looking forward to the conversation, especially with these two gentlemen. I've had the pleasure of interviewing one, Dr. Warner, good to see you, and Jason and I had some really great conversation about, can I say the brand name? Can I tell? Fox in the Snow? We bonded over cinnamon rolls and such, so this will be a great.
Yeah, let's just say I didn't have a whole bunch of my lunch here because I had a little bit of a detour on the way over.
Yes, that's a good detour, good detour. I wanted to kind of start there because for many people here today, you'll recognize that these gentlemen are relatively new to their respective roles. And Jason, you became the Cardinal CEO in 2022, and John, you took over at OSU Wexner Medical Center in 2023. Complementary organizations, but also pretty different. You can decide which person will take this first, but tell us about your organizations, how they're alike, how they're different, and how you work together.
Yeah, it actually may be better if I started out because there's some infrastructure for the overall healthcare industry that I can start with, and then that I think plugs in nicely to OSU. So when you think about Cardinal Health, the simplest way at the very highest level to think about it is that we are very much the infrastructure behind a lot of the healthcare industry. Now, that's the easy, simple way of putting it. Another way to think about it is we connect all the way from the clinical to the operational end of healthcare. So all the way from the innovators, the manufacturers of product, then we take it from there, pharmaceutical, medical supplies, all the way to the end customer, which in some cases is actually the end patient, but it's often customers like OSU, healthcare systems. It can be, for us, really any pharmacy. So, in fact, our largest customer is CVS, retail pharmacies. But it can also be the small independent community pharmacies. But that breadth, where pharmaceutical and medical products across that spectrum is really where we play, and then we work with each of those customers. The other way to think about it is everything that we do is effectively down to safely, securely, and efficiently delivering those products. It's more than just picking up a product and moving it over to where it needs to go. When you think about pharmaceutical products especially, there's a lot of regulation, a lot of control. So the safety side, certainly you as a patient want to know that it came straight from the manufacturer, that there was no intermediary between. We are the intermediary, work entirely hand-to-hand with the manufacturers, the big pharma, and then the customers that in the health systems that guarantee that there's no gap in that supply chain. The securely side of it is to make sure that those drugs don't get into the wrong hands in the opposite direction as well. So we protect that both directions. And then the last part is, of course, efficiently. We know that healthcare is expensive. We know that it is always a challenge from a cost perspective. And so our role is to take our leverage, our size, our scale, and that expertise to make sure that we very cost effectively get those products into the hands that needs them, as well as the service levels that are needed to solve their problems.
Thanks. It's so Jason, I met very early on after my arrival to Columbus. We've been partners in many of these things with Cardinal Health and throughout my whole career, and so there is a lot of interplay between the work that we do together. I think of, and so I'm at the Wexner Medical Center, an academic medical center, and to me I think about our work kind of in three very tightly integrated missions. First of all, we provide care and service to patients and families throughout Central Ohio and beyond. And so the care that we deliver and the way we deliver that care is our core mission. We're here to care and serve for patients and families. Those missions are supported, that mission is supported by our other two missions, which is medical research. We like to think of ourselves as being on the very forefront of innovation and research into the most pressing medical problems of today. And so the work that we do is not only, and that encompasses everything from basic science research at the bench to clinical research at the bedside, what we're now calling implementation science, ways to think about improving the lives of people in communities, and also the study of populations as well. And then our third mission is really training the next generation of healthcare providers, and that's not just doctors, particularly at a place like Ohio State. That's all the members of the team. That's nurses, therapists, social workers, you name it, all the members of the teams that now care for patients. That, to me, is the biggest change in my 25 years or so of academic medicine, is that I call them now reactions or interactions in parallel as opposed to interactions in series, so that people are coalescing around patients and families in ways. So that's how we work. All those missions are tightly integrated. Each one of them depends on the other. Research drives the innovation that leads to improvements in patient care. The work that we do in training the next generation of providers also contributes to these high-performing teams that really are transforming the way that we deliver. So that's a short list of what an academic medical center is to me.
And so we heard a bit about how your missions are focused and a bit how you're different. I would say that your organizations, Ohio State, 24,000 employees, Cardinal, 46,500. Wow. So how do you lead these organizations? And do you know everybody's name?
Well, I don't know everybody's names. That's the biggest change for me. I spent 20 years in the last organization where I was at in Texas, and I knew a lot of names, and so here that's been challenging, but I'm getting better. I think, leading a big organization like each of us do is a lot of fun. because of those three missions. I think the most satisfying part of the job is being intricately involved in all three. The care and delivery of healthcare, training the next generation, and also sort of being involved in sort of making sure that the right culture exists for real innovation and research. And so I think of myself as kind of conducting the orchestra, and so the key is to have people playing the parts well, to have the talent in the room to make great music together, and then my job is really making sure that people have the environment to learn and grow, to advance those best ideas, and then making sure that everything we do ends up in improving the care and service that we have of patients. So it is a big job, but it's a lot of fun. It's every day is different, every hour is different, and so it's really a fun thing to be part of.
John said fun a lot more times than I will. I get a lot of satisfaction out of my role, but it's also a very challenging industry, a very challenging business, but we're very proud of our role within that. I think, simply put, and I think there's a lot of correlations to what I'm going to say and what John just said. I think you start with the strategy and the vision. I've only worked for large organizations. This is probably about average in terms of the size of the companies I've worked for. And in each case, when you have that many people throughout the world, we operate in over 30 different countries throughout the world, and they need to know where they're going. They need to know where we're going. You got to start with that vision and that strategy, and you just have to pound it in every single day to be consistent with those messages. But that's the highest level, and that's certainly not where we stop. We then have to cascade that down into plans, actions, and then hold ourselves accountable with KPIs and metrics to follow that each and every day. But it really does start and end with the people. So my role is certainly to make sure that vision is straight, that the plans and actions are in place, and we're holding ourselves accountable. The other key thing that I think is very consistent with what Dr. Warner just talked about is we have to have the right people in place, the right team in place. I think any business, even if you're a 5-person outfit, that one single president, whatever you want to call that person at the top, they're not going to be successful if there's not the other 4 that are working hand in hand with them. As you can imagine, with 50,000 people, it's even more important that you have the right people that are choosing the right people that are choosing the right people all the way through the organization. And it has to be very much customer-centric, customer-focused. That has to be the outcome. Of course, we're all measured on the financial performance with the public company, but ultimately that is short-lived if you don't have really delighted customers. That is very much a part of that future.
Let's move to talk about healthcare and we'll start with you, Dr. Warner. Just talk about some of the major trends that you see sort of shaping healthcare.
I think it's the most interesting time in healthcare that I've been involved. So for those of you who don't know me or didn't Google me or whatever, I'm a cardiologist, so I've been involved in heart care and heart research most of my career, but sort of broadened my horizons to a few other areas over the last 10 or 20 years. But I think there's a lot of interesting things happening at the moment. First of all, I think we're beginning to think of we're tackling harder problems, I think, than we've ever tackled. So some of the diseases that I thought of as life-ending without much hope 10 or 20 years ago or now have a lot of opportunity and hope. So if you see the improvements in cancer, if your lives have been touched by people with degenerative brain diseases, those were once thought to be death sentences for people almost from the moment of diagnosis. And now you see people, even with advanced diseases, living a long time and having very productive lives. That's because I think we're beginning to make some real advances in terms of things like really understanding the underpinnings of those diseases, not just what's right in front of you in terms of whether it's a cancer diagnosis, but also the risk for certain things. So if I had to predict kind of where medicine is going, things like gene therapy are making amazing progress quickly to be able to not only sort of deal with the impact of a certain health problem, but to actually change the body in a way that might be able to either mitigate the impact or perhaps even prevent it. And so those types of things. We understand metabolism in a very different way than we did even just 5 or 10 years ago. So you're helping the body's immune systems and metabolic components sort of fend off diseases or perhaps even eliminate them. So things like immunotherapy, if you've heard the words. So things are going very quickly. So I think this is likely to be the most rapid period of change that I've experienced in healthcare, because I think we're beginning to understand things like genetic code in ways beyond just sort of understanding what the gene is, but actually what it's doing and how we might manipulate the outcome. So I think it's going to be a really inspiring and innovative time. The other thing I would say is, we're understanding risk in a different way. So there is this moment where people move from wellness to being at risk for a health problem. So we call it sometimes transition from wellness. So we're learning more and more about when those moments are actually occurring and what we might be doing differently. For example, we know that in certain families that have a high incidence of heart disease, we can find cholesterol deposits in children that might be as young as 5 years of age that are abnormal. So if you were able to ascertain that, you might do things differently with your children. They might exercise differently. They might eat differently. You might intervene earlier. So this idea that we're beginning to understand risk earlier in life so we can intervene and prevent those types of problems, I think is one of the more exciting areas of medicine.
I think that's one of the most fascinating studies, because it probably could change how you educate them. Maybe they're not going to be playing video games so much, for example. Do you want to add to that?
Welcome change, I think, as someone who has two kids that did a lot of that.
Yeah, I'm glad I'm Caden's second, because I can just say what he said. Dr. Warner is definitely much better positioned than I to talk about the innovation that is going to be coming in healthcare. What I can reiterate and support behind what Dr. Warner said is that we see innovation everywhere. It's clearly going to happen. It is clearly happening. The other thing that is clear about the healthcare industry is a bit of just demographics, right? So over the last 15 years, the number of Americans that are over the age of 65 have increased by 50%. That creates a whole burden and challenge to the healthcare industry. It creates a lot of opportunities as well. And that number will continue to increase for the next 40 years, where it will increase another 50%. So that is a requirement upon the industry to continue to grow, not just with the innovation, but with just the sheer volume. Why 65 is important is that's kind of a psychological threshold where the need for care just continues to increase or increase even greater. What I can talk about separately and independently then from innovation about where healthcare is going is in the sites of care. That is also going to continue to evolve. More and more people choose when they can to get their care at home or through more of an ambulatory surgery center or something that's a little bit closer to home, a little bit less big hospital-like, but it's still needing the innovation and the expertise that comes from the larger healthcare systems when there's a more of an emergency type of situation. So that site of care into the home will continue to be a trend. Innovation in other ways, like with data, I think it's embedded in a lot of what Dr. Warner talked about. But our ability to take data and analyze it and use it in different ways, not just with the physician and in a very clinical setting, but also literally through the data files that go between the different pharmacies and the different physicians and the different healthcare systems. That information can be used in many different ways to then help provide that content and that context to the pharma manufacturers to know where those trends are going. And that just opens up a lot of other kind of bigger picture opportunities for the industry.
Along that line of medical technology, sometimes I feel like we're in a movie. Things are moving so fast, or I have to reread what we report. Jason, I wanted to have you talk about some of the greatest advances you've seen in the past decade in terms of, medical technology. Your eyebrows, like,
Me or you? Well, I've been in healthcare for 4 years, so I'm going to go back for. But let me make sure I'm clarifying.
Yeah, just some of the what you think have been some of the greatest advances, and you don't have to go back 10 years, but
Yeah. Well, so okay, so this one's a little bit of a curveball from you, which is interesting. So. When you think about where we were 10 years ago from our perspective in terms of the infrastructure, it has really consolidated quite a bit. Mm-hmm. And so that has brought, and the consolidation was really a necessity because of the cost. When you think about 10 years ago, there weren't the buying groups, there weren't the hospital systems, healthcare systems have all consolidated. The retail large customers, the CVSs, the Walgreens, they've continued to consolidate, and even in the smaller retail independents have had a level of consolidation. That's all been a necessity because the cost of healthcare has continued to increase so much, and we all know that over that period of time, inflation outside of healthcare was a lot lower before, so there was not quite the opportunity to catch up to it, and so it was a bigger and bigger part of those budgets. So the industry has changed a lot in terms of how it maneuvers through to the affordability that is necessary for that. So that's kind of an infrastructure kind of starting point. When you look at now the class of trade of what our business looks like now versus where it did a decade ago, it's really all about specialty. These more specialized therapeutic areas, oncology being the largest piece of that, has become a bigger and bigger part of it. It used to be a component of it, but now with more specialized physicians, more specialized solutions, more specialized drugs that continue to increase in cost, quite exponentially as well, but also the volume of what this care is able to accommodate is, it used to be, 10 years ago, probably 20% of the market. Is now over 50% of the pharmaceutical industry is in specialty products. So this is something that just continues to explode in terms of its value and of its, obviously the value to the patient, each and every year. And when you think about the growth prospects of that, that's expected to continue to increase at about a 10% rate, whereas the more historical, non-specialized areas in the typical acute setting would be in the low single digits. So you have this continued divide on more and more specialized products that require more specialized handling, temperature control, special handling, and of course a much higher cost that then is very challenging for those that have to figure out ways to pay for that.
Dr. Warner.
So I think about sort of three things. One is imaging, the technology around imaging. What we see now is so different than what we saw 20 or 30 years ago. The level of detail that we work at with CAT scans and MRIs, molecular imaging, all these types of things allow us to think about diseases and treatment options differently, and the pace of innovation in that space is only accelerating. So yeah, back, when I started, it was mostly x-rays. I mean, there were CAT scans, but they were pretty blurry, and so you didn't always know exactly what you were looking at. Now, the level of detail that we work at is truly amazing, and it's helping us understand the body and the diseases we treat very differently. The second would be what I call minimally invasive procedures and surgeries. I've said this to a few of the OSU people the last few weeks. I went back in 2000 and pulled my case list from 2003, so the work that I did in the year 2003. 90% of those cases would now be done in an ambulatory environment. They wouldn't require a stay in the hospital. Back when I did those procedures, all of them were in the hospital because, so the technology has allowed us to be less invasive, so we're able to do things with small operations that used to require big operations. We're able to do things with catheters and things like that that traditionally had been done with surgery. So what that's allowed for is two things. One, it's less an event in your life in terms of getting back to work, getting back to doing the things you want to do. Recovery is quicker, but also allowed us to take on some harder things by not having the morbidity associated with some of those procedures. So that's another area where I think innovation is stark. The other is the sequencing of the human genome. When I look back at when I'm sitting around retired, what I'll think about, that was a defining moment in American medicine. I think the commitment to do that, and it wasn't just America, but there was a significant investment made in that because it helped us build a catalog of genes, and then following that was a catalog of proteins that continues to evolve, and we just beginning to understand the body in different ways. And so it's allowed us to look and ask different questions and answer different questions. So those are three short things that I think have changed in terms of technology.
So one of you mentioned the age 65, and I know this doesn't apply to anybody in this room, but we're all getting older. What are the healthcare implications for our aging population here in Ohio?
I can start, sir. So, it's interesting. I've been in two growing sort of ecosystems. Columbus is going to grow amazingly over the next 10 or 20 years. I've been in Dallas-Fort Worth the last 20 years and had this exponential growth. It's kind of interesting. It was first it was a lot of people moving there. They liked it there. Their jobs were going well, so their parents moved there. And so we saw this really interesting trend about sort of the population evolving. I think that's what will happen in Central Ohio as well, as we'll continue to see a population of parents and grandparents moving to Ohio as the ecosystem grows. So that has important things. My parents are, my mom passed away a couple of months ago. My dad's 83. They have very different healthcare needs, I think. And, I think people are living longer. They're accumulating health problems and health risk. And so we're needing to build teams to care for people as they age, just like we do for people that are having surgeries. So it's a special problem, but also a special opportunity to, I think, really thinking about, the ability to prolong life in meaningful ways where people are able to still do so many things that they've enjoyed doing early in life, later in life. And so, but that's going to require, I think, a different set of ecosystems that we create for people that are aging. And so building a team of people that are specialized in helping people kind of hold off the forces of nature over time so that you're able to still exercise and participate in the things that have meant so much to you. So I think that's another area where I think science is really evolving very quickly, is really thinking about, what does aging mean? What are ways that we can intervene while people are aging to really improve the quality of their life going forward?
Yeah, the only thing I would add is, back to cost, right? That this is great, right? We all get to live longer, but as we get older, the costs are exponential as you go, and there are fewer younger people to help pay the taxes that are necessary for us to get there. So that's a component that will be out there. And again, it's just math, because we know how many people that are going to be this age at that point in time. The only other aspect I was going to add is just the healthcare profession, healthcare workers. When you think about this bolus of people that are older and need that care, what we've seen, especially over the COVID period and to some extent still today, is a profession that isn't as greatly sought after as it once was. That is that's a challenge for the industry as there's more and more people that need the care, but are there going to be the number of healthcare workers necessary to get there? Back to a different type of technology, a different type of point with this is we talked earlier about data and technology being an opportunity to help understand where there may be some opportunities to serve that patient. The other part of technology is through automation and through other ways in which we can, as an industry, can work together. One of the things that we always do is think about our process combined with our customers' process to figure out if there's a way to make their jobs easier, more kits, more ways to allow that healthcare professional to take or find our product through inventory management systems or whatever it may be, so that they need fewer workers and healthcare professionals to serve the patient. So we're going to have to be more productive to be able to solve that problem.
We said math problem. The journalist in me almost had a moment. What should we do about our kids who are in middle school and high school? I mean, we need to talk to them about career opportunities, perhaps, in either of these. Your thoughts on where we're going to get these healthcare workers that we're all going to need as we're older?
Well, yeah, you need to go that first. That's a tough one. I don't have any silver bullet answers to that. Right. This is really about education. Mm-hmm. Maybe it's because it's top of mind because just this morning I spent the time with the Junior Achievement team here. I'm on the board of Junior Achievement in Central Ohio, and it's organizations like that that really give our young people that are still in middle school, high school, a better understanding of what the opportunities are out there. So I'll say Junior Achievement one more time so that I get the call out for a great organization that really is out there trying to help kids understand that there's a lot of options beyond what maybe their parents are doing or what their neighbors are doing, to really open their eyes so that they can help find those types of connections and opportunities. But that's just one example. There's a lot of great organizations like that, but it does need to come through education early on in life to know that that is an option. You try to do that later on. I think that's just a real challenge because it is one of those things where I think that's what we saw during COVID, is that it just wasn't a perfect fit for some people. It was like good enough because the pay was good compared to other professions. And then when the local warehouse started raising their pay, they realized, oh, well, maybe I can do this, maybe a little bit easier work or less invasive type of work at a similar pay. So you need to find people that really want to do this, and to do that, I think you got to find them earlier in their careers.
Yeah, it's a great question. I think it's the biggest business risk that we have right now as workforce, because we just talked about more people needing health care, everyone's living longer, they're going to have more health care needs, and yet at a time when we don't see the workforce growing at the same rate that the medical community is growing and the need is growing. So, I think about that a lot. My kids are not doctors, but they're both sort of in healthcare. My son works for a medical software company. My daughter works in the marketing and communications department of an academic medical center in Texas. And so I listen to them a lot, but I think their story has to be a story for a lot of us, which is they become interested in medicine and like being part of that environment and learning and growing. And I think a lot about ways that we can continue to do that better, and particularly, obviously now I think about with a very Buckeye-focused lens, allowing people to change careers within medicine to continue to evolve. And so, one of the more satisfying things I worked on in my life was having, environmental services workers trained to become surgical technicians. So they were able to take a $30,000 a year job, cleaning hospital rooms or cleaning operating rooms, and then become a surgical technician or assistant, making $70,000 or $80,000 a year. So it's life-changing, but also kind of continuing their own professional progression and learning more components. We're doing that with Columbus State at Ohio State, where we're training students at Columbus State to become surgical technicians in the Ohio State ecosystem in partnership. I think those kind of things have to be front of mind for us as we think about growing the workforce, is to kind of keep people in the family, but learning different things to do and that. The other is getting to people sooner. I think, being with elementary and middle school students is really important to plant the seed. I didn't always think, I'm not one of those kids who decided to be a doctor early. Until my sophomore year of college, I was going to be a forest ranger. I'm serious. You can look at my transcript. I got the proof. I caught more bugs than I did and took chemistry classes. But I think back, what inspired me to begin to think about it was involvement that I had in middle school and early in high school, when people took an interest in me and began to kind of gently have me think about, a career in medicine and how that might be rewarding. And it turned out to be the perfect choice for me. But I don't think that would have happened if I had not had some experiences with people that were leaning, sort of gently sort of guiding me towards a career in science or medicine. So we've got to get kids interested in this career field and then continue to cultivate those interests as they move and as they grow up.
Let's talk a little bit about community-based healthcare and your thoughts on the role of community-based healthcare.
Well, I think it is a sea change, I think, in healthcare now, is that kind of meeting people where they are. And so that's everything from doing the work that we've traditionally have done in large medical campuses in the community by building more clinics and community hospitals, customizing the care and experience in those settings to the communities that you're serving, but also involving the whole community in healthcare. We're spending a lot of our own energy in the East community here in Columbus, but not just taking what we're doing at Ohio State and doing it in the East community, but actually having real conversations with that community about what they want and need from us, and then customizing the care and service that we're doing. That, I think, is the most important part of the work, is having the conversations about how we might improve health and well-being together, and then building those partnerships so that we're all working. Because health is a dominant part of all of our lives, no matter what you do for a living, no matter where you live. And so I think that is a big piece. And as an academic medical center, I feel that's one of our primary responsibilities, is not only being part of those conversations, but also being stewards of those conversations in the community.
Do you want to add? Because I was going to go for another question. Okay, let's talk about mental health just for a minute. I know that the CMC is going to be doing a forum about that. Can you talk about how your organizations, what your role is in mental health? We've talked about the community and aging, and I feel like this would be a really good time to talk about mental health issues, because we've seen that play out in so many different facets.
Yeah, I'll go ahead and start. And this is an example of one area that our organizations have been working together, so I think it's a great topic. Well, so when you talk about mental health, there's really anything related to healthcare that is for the benefit of the community and for social causes. I think it's important to step back, think about every organization's culture and their values. And for us, we make that public through our corporate ESG report, and we there's a lot of things within there that, like a good citizen of our community, we want to focus on, whether it's the environment, inclusion, DE&I. But it also gives us an opportunity to really lean in on areas where we have an opportunity to make even more of an impact, because we're in the healthcare industry. So not only is it important for our community, but it's something that we should be an expert at. We should be able to bring on more resources and expertise, relationships, connections, to be able to make more of a difference. So mental health is absolutely one of those areas that through our ESG work, we said, we're going to lead in this area because we feel like we do it really well within our organization, and that there's still a lot more we can do for the benefit of the community, knowing that we're really just still scratching the surface. So first things first, you got to have your own house in order and make sure we have the resources, the tools in place to make sure our team knows that there are resources available. But to really get at the essence of your question, Tracy, that is really only a small part of it, because I think there's a lot of resources available. The problem isn't, I don't think the biggest problem is the resources available. It's the stigma behind people utilizing the resources. Yes, there can be more resources, but what's out there is not used to the extent. One of the campaigns we have, and Ola, sitting over here, has helped us launch this as an organization. It's okay to not be okay is what we talk about internal to our organization. We have campaigns around, mental health is a real thing. There shouldn't be a stigma to it. It is okay to not be okay, and you have all these resources, and you shouldn't feel bad about using them. And so that stigma was the reason why we hosted a mental health summit with Governor DeWine at the Cardinal offices a little bit, maybe about last year sometime, and we had Dr. Warner and other key leaders through the community come in, and we had a summit on this topic to try to take away this stigma, but also to listen to each other as to what other opportunities there may be for each of us to work together. And I believe Governor DeWine was looking for some budget opportunities at that point for some initiatives within the state, and it spurred some interesting actions from there. One thing that we've done as an organization since then is we've launched basically a training program. It's a 6-week course for healthcare professionals to come into our offices to provide some awareness to this topic and some tools to help them, not just for themselves as a healthcare worker. Mental health is a problem for them because of what they have to deal with and work through every single day, but also so that they can help their patients in different ways. So it's still in the earlier stages, but it's initiatives like that to get that message out there, get people the tools, but also to make sure that the awareness that the stigma should be something that we address.
Yeah, I'll add that's how Jason and I met, was at this symposium with the governor, and I've learned a lot from Cardinal Health and the work that you're doing in the mental health space. I would add on to what Jason said. I think as a leader, your responsibility is to do just what you said, to remove the stigma. It still exists in workplaces, and it shouldn't. I mean, when someone gets cancer or is in an accident, we all spring into action to help them. Mental health is simply health, and so we ought to approach it the same way and build a culture in our workplaces where it's okay to ask for help, okay to receive it, and that we're all coalescing around people in the same way that if someone's diagnosed with cancer. And so we've got some work to do there. I also think as an academic medical center, we have a responsibility to study it. We know less about mental health than most of the diseases that I've talked about earlier today. So Governor DeWine's been a strong proponent of that. When many of you have heard about the SOAR study, the State of Ohio Action and Resilience work that we're doing, looking prospectively at families across the state of Ohio, studying those families to understand who might be at risk for mental health issues down the road, and finding ways to intervene sooner. One of the big components of this work, the State of Ohio Adversity and Resilience, two different SOAR words there, is going to study 1,200 families longitudinally in Ohio, about 3,600 members of those families, to really understand them and to understand risks that they might incur early and how we might do that. And that's not just socioeconomic risk, that's imaging people, that's collecting blood so we understand, look at biomarkers that might predict diseases. and also imaging them in ways that we can study them and their brains in ways that we might predict. That in cardiology has been the most transformative thing. So if you follow cardiology, there's been 3 or 4 of these longitudinal studies over the last 50 years that have defined what's a normal cholesterol, what should your blood pressure, what should it be, how much should you exercise, who needs a stress test, all those kinds of things. We've done nothing prospectively like that in mental health. This is the opportunity to do that, to understand who's at risk and what they can do to mitigate that risk.
I get to ask one more question before we turn it over, and this one's going to be a real tough one. You guys are both these leaders of these massive organizations, global relations. We want to know what inspires you. What are you reading, watching, listening to that the rest of us should know about?
What inspires me more than anything is the mission-driven aspect of what we do. Sometimes you get lost in the day-to-day of firefighting and all that, but at the end of the day, there's so many healthcare professionals that rely on us getting the products to the right place at the right time. That's that extra oomph that gets you through the day. I'm not a real exciting person when it comes to the stuff that I review and read. It's a lot of. I'm a current news type of person. I spend a lot of time. On business news and Wall Street Journal and exciting stuff like that, because the breadth of our business, the breadth of our customers is incredibly broad. My enjoyment and what I really get a lot of personal value out of is my family. I've got 3 kids, 2 in college, 1 in high school, which means they're in 3 different locations. So of course, my wife thinks that we need to go over there and fix all the problems all the time, which means we have to go and travel and see them all the time. But at the same time, it's a very satisfying and fulfilling situation that we have. For fun, what I also like to do, and I've just picked this one back up, I dropped it for a while, is there's a book that I am reading just to try to at least attempt to answer your question. I think it's called Business Adventures, and it's an old book, actually. I think it was written in the 60s or 70s, and it's a story of a bunch of American business tragedies. I do like to learn from the mistakes that those before me have made, so that I never make the same mistakes, and that we all learn from that, because that's very much, things repeat. And whenever there's a new problem, you look back and say, well, was it really that much of a new problem, or was that just a little bit different shade of a problem that we had before? So that's what I'm currently trying to work through, but the hours seem to get short in the day.
I always hate when people ask me that question, nothing personal, Tracy, but it's because I'm really a boring human being. So, and I'm always thinking, how can I sound less boring? But I just am. But I can say what inspires me. I think for me, in healthcare, almost every day you hear of an outstanding outcome or an outstanding experience that someone had receiving that outcome, and that sort of keeps me going every single day, because it's all around me, the great care that's being provided, the dedicated people that are providing that care, and then the commitment to service that exists in our organization. I also love seeing students and residents as they're learning, see those lights come on when they really kind of get it and they understand something in a different way. And then also being around scientists that are really thinking about important problems. And when you see one of those things begin to click, and you realize the impact that it's not only going to have for that scientist and for his or her team, but also the impact that it could have on medicine, makes for a very inspirational job. I, like Jason, I like reading about leadership. I like to continue to learn. I'm finding myself reading more and more science each day, because the pace of change is so quick in science. I feel like in order for me to be involved in conversations, I have to learn more. So I'm reading more about genomics and all these kind of nanoparticles, all this kind of stuff that I don't know much about. And so I'm trying to get more and more literate. But again, I think for the most part, I have the best job I could ever imagine, because of the variety of interesting and smart and dedicated people I come in contact with every single day.
Well, we appreciate you all answering that question. CMC, it's a tradition to take your questions. We'll get some questions from the live stream and some in-person questions. If you want to make your way to the back, Doug is standing back there. Come on down. You guys missed that because you're at work. That's a Price is Right reference, sorry. But we'll get your questions there. Doug, do you have a question from the live stream?
Yes, Tracy, thank you. And I got that reference, but thank you very much. For those of you who are here in the room, I know you have lots of questions, so please do join me at the microphone. If you're watching online, please enter your questions into the chat. And please do keep in mind that great questions at CMC have two things in common. They can be asked in less than 30 seconds, and great questions end with a question mark. So here's our first question. What would you say to Americans who are or have become skeptical of vaccinations?
All right. Well, start with the softball. Thank you so much. I think a lot about this because, for all of us, the experience during COVID had a lot of sort of ups and downs, mostly downs for many people. But I think about the beginning of COVID when, I used to come home from work. I lived in downtown Dallas, and you would see people on their balconies cheering for healthcare organizations for the first year and a half, and healthcare heroes and all that stuff, and then moving to a period of skepticism that was well illustrated in the question, and when people begin to question many of the things that were in front of them, and sort of what changed, and I don't have the answer, to be honest, so I'm going to start with the caveat there. But I think when I look back at sort of what I or my organization could have done differently, I think we probably overstated in many ways what we did know, and maybe understated what we didn't know, because this was an evolving period of time where I think we are still learning about a lot of these new science developments and technologies. And so, and vaccinations, particularly the COVID vaccine, were something, the technology was not new, but the application was quite new. And so, if I sort of examine my own prior organization on sort of things I learned during that period of time, is that whenever you're innovating and moving quickly, there are going to be things that and there are going to be things that you're unsure about or you don't know. And I think as I think about vaccinations, that's another area where I think we have to step forward and let people understand the data we do have, what we think the implications of those data are, but also be honest about the unknowns, because there are some questions that have been unanswered. So in general, I believe that the vaccines are safe and effective, but I also think they're just like anything. Sometimes you don't know for the next 10 or 12 years what all the different questions that are still unanswered, what those answers are going to be, and being honest with people about that. And so when I hear the conversations, that's sort of one of the conclusions that I take from that.
Hello, I'm Jeffrey Lemichuk with CareSource. So you talked about how technology in healthcare has improved our lives, efficiencies, economy of scales. In the economics and all other industries, when those come into play, costs go down. So why is healthcare so expensive, far exceeding inflation, if we've made those improvements?
Yeah, another softball. So I can tell you that without a doubt, the healthcare industry has become a lot more efficient. So it's a very complex question, and the problem is there are a lot of different intermediaries throughout the step. This is something that even Congress is not able to answer, and they've done all sorts of RFIs to try to get at the essence of this. The one thing I would like to highlight more than anything else is we should be proud of the innovation that our large pharma manufacturers are bringing to the industry. That innovation is expensive. And just some of the things that Dr. Warner talked about before, it is getting into more and more complex, more and more innovative ways. The pace of change is very fast. When you're going and getting a simple product done, I can tell you it's a lot cheaper than where it was 10 years ago. That cost has come down dramatically. And you see those types of things. It's when you're getting into that specialized care and you're getting those problems that wouldn't have been treated in the past to be treated today, yeah, that's very, very expensive. But when you're doing apples to apples, I don't think that the pace of inflation is extraordinary, at least compared, hey, everything is more expensive today than it was 4 years ago. But when you think about, I think the essence of your question, Jeffrey, I think a lot of that is because you're getting into specialized care with a newer innovation, more IP, and frankly, a little bit lower volume too, because you're solving with similar types of costs to create the innovation. You're serving fewer people because it's in a more specialized area that may not have had the same level of scale in the past. Anything to add?
Yeah, I'll just add one quick comment. We're one of the few industries actually that's still paid by the volume of work as opposed to the outcome. I think you'll see that change over time when we're paid differently in terms of the reimbursement mechanisms for us, and so the better the quality of our work will eventually be rewarded a little bit more differently in the way that we're able to care for populations of people as opposed to individual transactions. That hasn't moved yet, and so right now a lot of the incentives aren't aligned, and so I've been saying that now for 20 years and they're still not aligned, so some work to do there.
Well, this next question builds on the answer that you just gave, Dr. Warner. Marla Jones asks, are healthcare providers or healthcare leaders looking into how to lower the costs associated with senior facilities? Average citizens may not have the funds to pay for services provided.
That's a great question, and I am glad that you asked that, Marcia. So we all are focused on that. Again, because many seniors have fixed incomes and the amount of healthcare and the cost of healthcare is a larger percentage of that fixed income than for people that are at different stages of life. So, again, my own parents have been receiving a lot of healthcare the last few years. So I've been thinking a lot about that as well. I think a lot of that is, again, building a system of delivery so there are teams of people involved that can care for seniors in ways so that they don't have to dedicate so much of their effort and time to going to see 5 doctors. Where my dad lives, my dad hasn't had a doctor's office visit in 4 or 5 years. They're all performed in the facility that he lives in, so it makes it really efficient for him to get teams of people caring for him. And I think it's been very cost effective for him because he has a sort of a system around him in the facility that he lives in to allow for care. So I think those are the types of things that I think we're going to have to be thinking about, is how do we, again, meeting people where they are in the circumstance that they are, so they're not expending so much time but also money in ways to receive very uncoordinated care. It matters even more as you age.
Hi, my name's Chris Arecchio. I'm a retired physical therapist. I'm interested in your perspective on the innovations around prevention, and particularly you mentioned it a little bit there, aligning some of those incentives to grow that area.
Guess I'll take that one again. Yeah, I think that's a space that's growing rapidly, and again, I think that's where incentives in the industry are going to matter a lot. So as I'm a cardiologist, so I'd much rather prevent something than treat it as a patient too, as well. So I think building the right incentives are going to be critically important. So this is where population health is important. Where you're caring for people longitudinally, so you're incentivized both as an industry and as a provider or a therapist or member of a care team to really to work on optimizing the health of people so that they can A, not have a health problem, or B, if they get one, to recover from that more quickly and get back to their life before that health problem exists. So prevention's a big space. It goes back to a little bit of what I said earlier, finding out who's at risk, first of all, because different people need different levels of attention according to that risk, but also building in the paradigm for people where prevention's important, and there's time dedicated for it, there's resources dedicated for it, and it's delivered in a way that's complementary to the care environments that exist now.
Yeah, the only thing I'd add is that's back to, I think, the conversation as well in terms of data and AI and how can, because when you have that relationship with a doctor and you can have that type of dialogue and a little bit of a hand-holding to it, then that's fantastic. But to allow the system and the machine to identify risk areas that may not be evident to even a trained eye, that's where data more and more will at least provide tools for that healthcare worker to have a better understanding of what may be out there that they need to be more focused on.
Thank you. We have about 2 minutes for one final question.
Thanks again for the time today. Any opinions, suggestions on investments that the community, region, or state should be making in order to really cement Ohio, Columbus as sort of a center of gravity for healthcare innovation and care?
So I'll say, so as the newbie to Columbus and to Central Ohio, first of all, this is a great environment for healthcare in general. And one of the reasons it's great is the collaboration. That doesn't happen in every large city, large community. The thing I love about this place, one of many things, is that the systems work together to make healthcare an asset for Columbus and for Central Ohio. A lot of big cities, it's kind of hand-to-hand combat around, what market share you have, all that kind of stuff. Not that we don't all think a little bit about that, but I think all of us are keenly focused on the fact that if we work together, that is a way to attract companies, to attract innovative businesses, and that making healthcare high quality and an asset for the community is critically important. That goes to the same space in innovation as well. With all these interesting and high-performing companies moving to Columbus and Central Ohio, how can we work together to leverage the talent that we have in all of our businesses to really improve health and well-being in meaningful ways? So, all these, Intel's bringing all these smart people, all these different subsidiaries that are coming with them. We'll have a lot of very innovative people that have been thinking about similar problems most of their career. So I think it's a real opportunity for Columbus and Central Ohio to step forward because of the ecosystem that's already in place where people like working together and really taking that to the next level as more talent enters the market.
Yeah, I know it's not, the essence of the question was more of an innovation question, but from an infrastructure perspective, there's a reason why Cardinal Health is based out of here, why our largest distribution centers for most of our key businesses are here in Ohio. Just geographically, first of all, we're lucky in that regard. This is where we plant our flag, but it's also just centrally located to so many of our customers, so it's a natural place for us to be. And it's also a good business environment. And so I don't have specific asks in terms of where we're at, but I can tell you that the state, local representatives are always working with us in a way that I've lived and worked all over the world, all over the US, and I see it unique here where it's a large community, but not so large that we don't have really good understanding of what each other is looking to accomplish. So whether you're talking about innovation or you're talking about infrastructure, I do believe that our representatives here have an understanding of what type of positions, what type of investments, what type of infrastructure is necessary for us to be successful. And they're asking those questions to us, like, hey, what do you need to be successful? Our last two distribution centers in the last year or two were both here in Ohio. So we are adding more investments here because we see it as a good business environment today, and we have confidence that it's going to be a great business environment in the future. That predictability gives me the confidence to make big investment decisions today because I have to have that longer-term foresight.
This has certainly given me lots of notes for future stories, so good conversation. Eddie has given me the high sign. I'm going to take my leave. Thank you.
Okay, I'm back up here now. Thanks for the candid answers to the questions. I hope everyone found today's forum enlightening and exciting and encouraging, really, about what this region can do to really establish itself as leading in this industry. Thank you to presenting sponsors of the Optimal Health Series again, the Ohio State University Wexner Medical Center, Nationwide Children's Hospital, and Ohio Health. And thank you to the sponsors of today's forum, the United Way of Central Ohio, Cardinal Health, Ohio Life Sciences, the Columbus Partnership, and our host, the Ellis. We're also grateful for the presenting sponsor of our live stream again, Center for Human Kindness at the Columbus Foundation, and our live stream partner, the Columbus Dispatch. And a very special appreciation to today's speakers, Jason Hollar, Dr. John Warner, and our host, Tracy Townsend. Please make plans now to attend next Wednesday's evening mini forum, Shaping Columbus, Influencers and the Power of Community Narratives. We'll host leading social media influencers for a happy hour conversation on how social media is shaping the identity of our city. Thank you again, everyone. We could not do this without you. Have a great afternoon.